So hello everyone. Today we are going to learn about the surface landmark of the lungs. So as you all know, the surface landmark of the lungs will help you in many of the clinical examinations such as percussion and auscultations. So let us begin. To locate the lungs, we have to make a certain points. So the first point that we are going to mark is the midpoint of the clavicle. So if the midpoint of the clavicle is lies somewhere around here, so that will be your first point. After marking that, just go 2.5 centimeter above the midpoint of the clavicle but towards the neck. Okay, so this will be your second point. So after marking this, let's move forward. Now the third point will be onto the level of second rib. So in other words, this will be at the level of sternal angle. So the third point will be lying somewhere around here. So that will be your third point. So after marking this, now let's move further forward. So the fourth point will be at the level of fifth intercostal space. So let's just find where does this fifth intercostal space lies. So yeah, so this will be your first rib, this will be your second rib, this will be your third, fourth and fifth. So you can locate over here, this is the location where your fifth ribs lies. Okay, so let us mark the point at this level. Okay, so just little bit below the nipple, there is a fifth intercostal space. So this will be your fourth point. Now after completing that, we have to go to the sixth rib. So if this is the fifth rib, this will be the sixth rib. So for the marking this point onto the sixth rib, you have to mark the point onto the mid clavicular line. Okay, so again, if you really remember, this will be the mid clavicular line. Okay, which will begin from the middle two third of the clavicle and it will extend up to the mid inguinal point. Okay, so this will be the your sixth point, sorry, fifth point. Now for the sixth point, what we have to do, we have to rotate up this body little bit and now we have to mark the point onto the anterior axillary line. So this will be the anterior axillary line, and onto the anterior axillary line the point will be marked at the level of 8th intercostal space. Okay, so somewhere around here will be the your sixth point, and the last one will be onto the more little bit onto the posterior side, onto the posterior axillary line. So if you really want to know where does this posterior axillary line lies, so this will be the axillary fold. Okay, so this will be your posterior axillary line. We have to mark the point at the level of 10th rib. Okay, so here the point will be lies somewhere around here. Okay, so after completing this all this point, now what we have to do, we have to just join all this point all together. Okay, so this will begin from here like this, then we'll to the second point, then to the third, then to the fourth, fifth and yeah, onto the posterior aspect. It will extend further. Yeah, it will reach all the way up to like this, and then you have to join this first point with the last point. Okay, so this will give you the landmark of the lung. So now let's just get the lungs. Yeah, so here you can see the margin within the lungs. So this is the surface landmark of the right lungs. So first point, so let us discuss the surface landmark onto the left side now. Okay, so the first point will remain the same. Okay, second will also remain the same, even the third one remain the same, but at the level of fourth intercostal space, now we have to go 3.5 centimeter
Fifth
lateral.
point lies at the level of
Okay,
fifth
so your
intercostal space,
3.5
4
centimeter will lie
centimeter
somewhere
lateral
around here,
from the
and
midline.
after that on to the sixth intercostal space you have. Okay, and other will remain the same now. Okay, so this will be the sixth intercostal space, then yeah, then we have to go for the eighth one. Okay, onto the anterior axillary fold, so this will be your anterior axillary fold, so 8 point will remain over here, and then posterior axillary fold lies somewhere around here, and this will be the, yeah. So now let us draw the landmarks again. Okay, yeah, so the first point, then you have to move like this, then yeah. Okay, so this will be the landmark of the left side lung. So the space which remain in between middle area, okay, this area, this space is known as an area of cardiac dullness. Okay, because the percussion examination of your heart will perform over here. This will help you in finding many of the clinical findings such as pericardial effusion. Okay, so this is the landmark of the lungs. So with this I'm going to complete this topic.